My name is Chantel, and I'm going to go over my disease choice, obesity. I'm going to do a walkthrough with you on obesity through cause, symptoms, treatment, prevalence, and prognosis. Causes: obesity, how and why? Genes, diet, lazy. Why? Exploring the why on obesity. We are looking at items such as poor diet choices, which include high intake of processed foods, sugary beverages, and fast foods, lead to excess calorie consumption, lack of physical activity, sedentary lifestyles, especially desk jobs, and excessive screen time can reduce calorie expenditure. Genetics. Family history can influence metabolism, fat storage, and appetite regulation. Socioeconomic factors. Limited access to healthy food, safe exercise spaces, and healthcare can increase obesity risk. Emotional and psychological factors. Stress, depression, and emotional eating can lead to overeating and weight gain. Sleep deprivation. Poor sleep disrupts hormones like leptin and ghrelin, increasing hunger and cravings. Hormonal imbalances. Conditions like hypothyroidism and polycystic ovary syndrome, or PCOS, affect metabolism and fat distribution. Medications. Certain drugs, antidepressants, antipsychotics, corticosteroids, can cause weight gain as a side effect. Gut biome. Emerging research suggests that gut bacteria may influence how the body processes food and stores fat. Age and metabolism. As people age, metabolism slows and muscle mass decreases, making weight gain more likely. Why this matters. Obesity is linked to serious health conditions like type 2 diabetes, heart disease, high blood pressure, and certain cancers. Understanding these causes helps guide prevention strategies and treatment plans tailored to individual needs. Symptoms of obesity. While obesity itself doesn't always produce direct symptoms, it contributes to a range of physical and metabolic issues that can affect daily life and long-term health. Items such as excessive body fat, shortness of breath, fatigue and low energy, joint pain and back pain, difficulty with physical activity, or difficulty doing everyday activities, sleep apnea, skin issues, and mental health. There are associated dangers and diseases that come along with the disease of obesity. Obesity increases the risk of many chronic diseases, including type 2 diabetes, heart disease and stroke, high blood pressure, certain cancers like breast cancer, colon cancer, and liver cancer, fatty liver disease, gallstones, osteoarthritis, kidney disease, and complications from infections like COVID-19. Also, mental health challenges. There are some treatments out there to assist with obesity. One would be lifestyle changes, considered the first line of treatment. Healthy eating, reducing calorie intake, and focusing on nutrient-dense foods like fruits, vegetables, and whole grains, and lean proteins. Portion control and limiting sugary drinks are key. Physical activity, at least 150 minutes of moderate intensity exercise per week. Things like taking brisk walks, cycling, even taking the steps is recommended. Gradually increasing activity helps with weight loss and maintenance. Behavioral therapy. Counseling or structured programs help identify eating triggers, set realistic goals, and build long-term habits. Support groups and digital tools like apps can be beneficial. Weight loss medications are another choice. When lifestyle changes alone aren't enough, doctors may prescribe medications. These are typically recommended for individuals with a BMI greater than or equal to 30 or greater than or equal to 27 with obesity-related conditions like diabetes or hypertension. Common FDA-approved medications include semaglutide like Wegovy or tirzepatide like Zepbound, help reduce appetite and improve blood sugar control. Phentermine topiramate suppresses appetite and increases feelings of fullness. Orlistat reduces fat absorption in the digestive tract. Bupropion naltrexone affects brain pathways related to hunger and cravings. These medications are most effective when combined with diet and exercise. Other choices could be surgery. Bariatric weight loss surgery is one choice. Surgery may be considered for individuals with a BMI greater than 40 or greater than 35 with serious health conditions. Common procedures include the gastric bypass, which reduces the stomach size and reroutes digestion. Sleeve gastrectomy removes part of the stomach to limit food intake. Adjustable gastric banding uses a band to create a small stomach pouch. These surgeries can lead to significant weight loss and improvement in conditions like type 2 diabetes, but they also carry risk and require lifelong lifestyle changes. Medical devices and endoscopic procedures are another choice. These are minimally invasive options that include intragastric balloons, inflated balloons placed in the stomach to reduce hunger. Endoscopic sleeve gastroplasty stitches the stomach to reduce its size without surgery. These are there are these are newer options and may be suitable for those who don't qualify for or prefer to avoid surgery. Prevalence. As of 2025, approximately 40.3% of US adults are living with obesity, and 9.4% have severe obesity. This marks a persistent public health challenge, though some states have seen slight improvements in most recent years. Obesity rates remain higher among certain racial, ethnic, and socioeconomic groups and in southern and Midwestern states. Prognosis. Obesity is a chronic condition with serious long-term health risk, but the prognosis can improve significantly with weight loss and lifestyle changes. Even losing 5 to 10% of body weight can reduce the risk of complications and improve quality of life. Obesity affects nearly every system in the body and is associated with a higher risk of premature death, especially from heart disease, stroke, type 2 diabetes, and certain cancers. Prognosis depends on several factors, including the severity of obesity, presence of related conditions, and how effectively it is managed. Without treatment, obesity tends to worsen over time and increases the risk of early death. However, with proper management, many people can reverse or reduce complications and live healthier lives. The key is early intervention and sustained lifestyle changes. Obesity is not just an issue here in the US, it is being seen worldwide and is seen as an epidemic. I want to thank you for going along with me through a look at obesity.